Okay, we're going to finish up this section. Uh, Number 5 is the fallacy of causation, that your actions cause other people to feel a certain way, or that other people's actions cause you to feel a certain way. How many of you have ever said something like, "You make me crazy. You make me so angry"? Are you, in fact, a marionette and the other person is pulling your strings? I would say no. This reminds me of when I was little. My older brother and older sister would take my hand and make me, they'd take my hand and they would hit my face with my hand and they would say, "Why are you hitting yourself?" Okay, that's a very specific case of where someone can cause you to do something. But other than that, I mean, I remember we had a huge discussion about this a couple of years ago where a student did not believe this, where I said, no one can make you feel a certain way. At some level, you are choosing to feel this way. Yes, people's actions and words can be annoying. They can say them because they want to provoke you, but you don't have to be provoked. So, okay. Number 6 is the fallacy of helplessness. I always think of Eeyore, that there are forces beyond our control that determines our lives. Oh, well, I was born this way. There's nothing I can do about it. Or, there's no way I'll ever get ahead in this company because women are never promoted. I mean, that possibly is true. So I have a colleague who is exuberant. In meetings he tends to be loud. He cuts people off. He will say, "Well, I can't help it. I'm Italian." Well, so is my mother, and she's not that way. So I would argue that your cultural background is not your destiny. Okay. Uh, another, no, I won't. I'll save this for another time. All right. The last one is the fallacy of catastrophic expectations, where if something bad can happen, it will happen, which is if I ask a question in class, everyone will laugh at me. Okay. Now, my daughter has shared with me that this is one thing that she actually kind of does to manage her anxiety, where she imagines the worst possible scenario and then realizes that it's probably not going to happen. Or, okay, let's say this does, this happens. I say something in class and people laugh. Then I have to say to myself, okay, does that mean I need to stop talking? Should I drop the class? And then realize, well, they laughed because I said something funny. Okay, so these are the 7 fallacies. They are the 7 kinds of irrational thinking that can lead to debilitative emotions. Which of these are ones that you'd probably, maybe you do more often? And obviously, yes, I know it depends, but think of a situation where you have used any or all of these. Then you don't use them all in one situation, but you have probably used all of these. Okay, so it's great. We know what all of these are. We say, oh, yeah, I do this, I do this. Yeah, I've done all of these. Okay, so now what? What do we do about it? Aha. How can you minimize your debilitative emotions? Because we are all going to feel them. So, number 1, you have to monitor your emotional reactions. So, your friend has said he's moving to California and you're feeling sad. And then you realize you're not feeling sad, you're just feeling awful. You're like you can't get off the couch, and you have to say to yourself, "Wow, how am I feeling about this?" Okay. And then you say, "Okay, well, what is the activating event? Is it that there's a specific person?" Oh my gosh. I had a colleague when I first became a department chair. I had a colleague who who made it a point every week to call me into her office to tell me things I was not doing right. So she was definitely, I knew that when I interacted with her, I was going to feel awful. So that was a specific person. And sometimes because there's a specific person who makes you, can't say makes you, interacting with another person, you have these debilitative emotions. Sometimes there's just a certain type of individual. She was the kind of person who was absolutely sure. There was never any shade of gray. It was always black and white. And I realized I have a tough time dealing with those kind of people. It could be the setting. It could be that you're okay if someone says something to you at work, but if it happens outside of work, you're not okay. Or if it happens casually, in your other life, you're okay with it, but when it happens at work, you're not okay with it. It could be certain topics of conversation, just you leave because whenever people are talking about, I don't know, coronavirus these days, you just can't deal with it. It makes you, God, I keep saying makes you. You find yourself getting really angry. You find yourself getting furious, or you can't even, you're almost paralyzed with fear. So you want to possibly avoid those topics of conversation. Pay attention to your self-talk. What are you telling yourself? Are you saying, oh, this is terrible? See if you can dispute this irrational belief and say, okay, I don't have to like everybody. We'll call her Professor X. I don't, she wants to tell me things that she doesn't think I'm doing well. That's fine. I don't have to agree with her, and she is entitled to her opinion, and I am entitled to my opinion. I also thought about making a voodoo doll of her, which I never did. But so you dispute your irrational beliefs. No, I am not a bad person because I have chosen to do something this way. And change your self-talk. So I want to show you a diagram. This is based on Albert Ellis's work, which we talked about earlier. So what's the activating event? This should be easy to remember because it's alphabetical. What happened? Okay, Professor X said something really mean to me, and what's my belief? Oh, I'm a terrible department chair. So what's the emotional consequence? I cry on the way home. I get home and I eat my bag of Milano cookies, and I draft a letter of resignation to my dean. I'm exaggerating, obviously. Okay. But then I say, wait a minute. Why am I really such a terrible department chair? I've gotten good feedback from other people, so I'm disputing my belief. And then, okay, if I dispute this belief, no, I'm actually good at what I do. What is the consequence, the effect, or the consequence of challenging this self-defeating belief? Well, guess what? You know that phrase, if you think you can or you think you can't, you're right. So if I decided that I was going to follow the belief that I can do it, I did it. Okay, so great. We have minimized debilitative emotions. Can we maximize facilitative emotions? They have a picture there of, I don't know the actress's name. She was in a TV show about Kimmy Schmidt, Unbreakable Kimmy Schmidt, where she was, I thought she was annoying. She was very positive, but we can actually learn a little bit from her, that we should enjoy positive emotional experiences. We should savor them. I think we should store them away for when times are not so great. We can remember the good times. If you happen to be in a situation that is less than positive, that is challenging, think about it as an opportunity for you to grow. A little bit of a sidetrack. There's a lot of talk about post-traumatic stress syndrome or disorder, and what people don't always talk about, although the military has started looking at this more, is something called post-traumatic growth. That there are people can be taught to look at trauma and to actually grow from it. So if you're interested in this, I can give you some more information. All right, when you're in these challenging situations, focus on what you have gained and not what you have lost, which might not be easy in the moment, but if you have a chance to do some reappraisal, right? Challenge, dispute that belief, say, oh, how did I feel? How could I feel? So, and when you can, make sure that you choose compassion over contempt, and think about, rather than, okay, a good friend of mine did some training for us at Tunxus a couple of years ago, and this is part of Gestalt philosophy, psychology, education. And he said, remember that people are doing the best they can at any time. So this to me was really changed how I interacted in the classroom, because a lot of times there would be one student who, for whatever reason, I found annoying. And rather than losing my temper with that student, or really feeling frustrated with the student, I said, you know what? For whatever reason, the way the person is behaving is because it's working for this person. So what can I do? So instead of being contemptuous or angry, I tried to cultivate some compassion and think about what I could do to be more helpful. So are there situations that you are in where you can both minimize debilitative emotions and maximize facilitative emotions? Okay, this was chapter 8. I hope that if you have any questions, you will post them in the discussion, and I will upload these very soon.